So, hi, Veena and Cesar. It's lovely to see you both.
Hello. Nice to see
Hello.
you both too.
Yeah. I've been looking forward to our discussion because I think we wanted to talk about the place of peer review in the life of the clinical educator these days,
Yeah.
and maybe reflect on our own work as peer reviewers and how that might have impacted on our own scholarship and
Yeah.
activities in our day jobs. So I guess we should probably begin, for the sake of listeners, just talking about just a bit of introduction for each of us. And I'll begin by saying that the three of us met very happily working at
Yeah.
Norwich Medical School together.
Yeah.
And I guess it's fair to say we did a lot of faculty development work together.
Yeah.
Yeah. And I think journal clubs made up part of the
Yeah.
work that we did.
Yeah.
And thinking about peer review. I mean, not only in helping other clinical educators, but also because we were publishing. So we have
Yeah.
published work together as well. So peer
Yeah.
review, one way or another, has been on our minds and something we've talked about a lot over the years.
Definitely.
Um, so what about a bit of introduction for each of you? If you could tell our listeners about your main educational leadership roles, beginning with you, Veena.
Yeah, okay. I'm Veena Rodrigues, and I am the academic director of the progression pathway from the PG certificate in medical education to the master's course. So it's a 3-year part-time course, but I'm the course director for the middle year, the diploma year. I am a public health consultant by background, so I trained the hard way. I graduated from an overseas medical school, and I was at Cambridge doing the epidemiology and stats masters when I first came here. And I think immediately it was clear to me how important numbers were, how important it was to know how to peer review journal papers or to critically appraise journal papers. And then in my public health career, because my main role was in service public health, but aligned to the NHS, and more particularly in policy development, it was really, really important for me to be able to to critically appraise papers and to learn how to work with the numbers to put policies together that made sense to anybody else who was going to use those policies. And I think the big shift was when I sort of started veering into medical education a lot, realizing the differences between the research in medical education and the types of research I was drawing on in public health. So I think immediately from the quantitative research methods background, I had to float into the more qualitative or mixed methods background in research. So I'm really aware that a good critical appraisal is essential if you want to make sense of new publications. And with evidence-based medicine and evidence-based teaching, I think it's really important for our students to learn how to critically appraise papers.
Brilliant. Thanks, Veena. Agree with all of that. And Cesar, what about you and your current roles?
Thank you, Barbara. Actually, I was thinking while Veena was sharing her experience that I think all of us that come from a clinical or science background
Yeah,
do that transition to educational scholarship. And it's quite tough at the beginning. So
yeah,
Yeah.
I'm a dentist by background. I work as a practitioner for some time, and then I did that transition to more of the engaging with the scholarship of teaching and learning. Currently, I'm an associate professor in medical education at UEA, and I'm the course director for our postgraduate programs in clinical education and leadership. So our certificate, diploma, and masters. As well, I mean, it was tough at the beginning to engage with that scholarship, but I think that peer review is such a central element to provide that initial contact with the scholarship of teaching and learning. It forces you to engage with the literature, it forces you to absorb knowledge, and it actually makes you a better consumer of educational literature. So I think this is
Totally.
really, really important.
Yeah, I completely agree
great.
with that, Cesar. And I should introduce myself a little bit as
Yeah,
well. I'm Barbara Jennings, and for the sake of full disclosure, one of the reasons why I'm having this discussion is because I've been involved with MedEd Publish, the journal, Amy's online journal, for the last decade, and it's I being involved with that journal, which has always been open access, and has always required peer review. I've been involved in mentoring peer reviewers and also recruiting lots of peer reviewers. So, I'm coming from that position as well, and also from a life sciences background. And I became involved in medical education about 25 years ago now, and working at UEA, working at the new Norwich Medical School where the three of us met. So just picking up on some of the things that you both brought up, thinking about why is it useful to do peer review for the new clinical educator? Why might it be useful within departments for peer reviewers to be present? And I'll pick up on the things that you said, Veena, because thinking about your public health background, and which I always think of as the home of evidence-based practice, really. Do you want to say a little bit more about the impact on practice that within departments that we can have if there's active peer reviewing going on? Any thoughts on that?
Yeah. I mean, I've always worked across service public health and academic public health. So when I was in the service setting, we used critical appraisal and journal papers. We asked our trainees who were placed with us to do critical appraisals and present them as journal clubs. And all the practitioners who attended those sessions also got a sense of, was the paper of a high quality? Do we need to change practice as a result of something new that has now come out? So I think it kind of brought the theory and the practice together there. And it's been the same in medical education because, we are all thinking about how the world has advanced, technology has advanced, students' attention spans have changed, our own ways of delivering things have changed. And so I think we are drawing more and more on the evidence in medical education now to make sense of whether we need to change our practice, our teaching, our learning, and how we need to advise students to do this. So for students who progress on the education pathway and maybe go on to educational research in their master's level year, you can't actually carry out research if you don't understand study designs and research methodologies, both quantitative and qualitative. And as Cesar pointed out, we feel at home in the quantitative side of things. And I think it's really hard to make the transition. And I see that with our students all the time, the struggle to not look at sample size only, or not look at, what big numbers were used or not, and to understand how qualitative methodologies have a whole research ethos or design behind it, and what they can be used well for. And I think after the struggle, they realize that. And so I think journal clubs, critical appraisal of published papers, if we don't keep up with scholarly literature, then it's really hard to stay as a contemporary educator. And that's what I try to teach the students. And we've all had papers that were reviewed by others, and often, most reviewers are well-meaning, and you had a better product at the end. And to sort of have that, I think the quid pro quo is you need to do some yourself if you want that for your papers. And so this is what we need to start doing with our students more, I think, maybe guiding them to sort of look at this in a more scholarly way, I think, and develop their own skills.
Yeah. And Cesar, do you have anything to say about that, considering peer review as a scholarly activity?
Yeah, of course. Actually, I was reading a paper quite recently from the New England Journal of Medicine based on AI in clinical supervision. I mean, I'm not gonna go in details of what the paper was, but it just gave me a perspective of when you are engaging with the scholarship of teaching and learning and peer review, you look at papers in a different way. And the authors, I mean, you start criticizing papers in a different way as well. Because you could think that, all right, we're going to see AI in clinical supervision. We're just going to focus on what the software says, what the answer is going to give us. No, but this was much more focused on how we could prevent that de-skilling or mis-skilling, and how we could make AI support clinical reasoning, and how we can facilitate learning using the tool. So I think that is really important on how your mindset changes when you're engaging with the teaching of scholarship of teaching and learning. You are just not teaching a simple thing. You are finding ways of facilitating learning based on the literature and based on evidence. And that is a huge step on becoming on becoming an educator rather than just a teacher. So I think that's really
Absolutely.
important. And the other thing is that doing the peer review exercise is such a powerful faculty development exercise as well. We usually think of faculty development, of formal courses, attending a seminar, attending a workshop, but we don't think of those informal faculty development things that we could do. And engaging with peer review is a powerful way of advancing your own career. So I think it's really important to do that, especially for early career educators. I mean, I would encourage people to do it and get on with it. Do it, start engaging with journals that you read, and start doing it as a way of advancing your careers as well.
Yeah, that's brilliant. So I think to summarize a little bit, we're talking about upskilling as part of your professional development, becoming confident about the literature, the transition that happens for all of us as we move from our discipline, in my case, human genetics, could be public health, could be surgery, but we move from our disciplines into a whole new discipline of medical education with the help of being enriched by reading, closely reading the literature and understanding the methodology that's important. So I think those are really key things. I'll just add one thing now as another rationale for why we should be peer reviewing. And that's a sort of social responsibility. So if I think about all the papers that I've published in my career, every single one of them, I depended on 2 or 3 careful reviewers doing a peer review of those papers. And as Veena said, in most cases, providing information that could improve my paper and improve my future papers, because it made me think about particular things. So I depended on that. So I guess in the last sort of 10, 15 years of my career, it was really, I was really mindful of this idea that if I published a paper, I had to make sure I did a good few peer reviews to do my bit, to be part of the scholarly community and to pay back, if you like.
Yeah, giving
back. Are there any thoughts on that idea?
I mean, it is a sort of a payback, but I think more importantly, you can't write papers, you can't carry out research if you don't know enough about research methods. So I think when you're starting off as an educator, the important thing is to learn about study designs or different types of research methodologies and analysis of data, software maybe, things like that. Because if you are going to carry out a research study, you need to know what design suits it, and therefore you need to think about the methodology and all of the stuff that goes into carrying it out to the point of publication. So you can't get there if you haven't got the basics. So I think you have to start somewhere.
That's absolutely right.
I think it also makes you a better author and researcher as you better understand the process. Sometimes when you're starting, you don't really understand how the process unfolds. And when you engage with peer review, you understand from the point of view of a reviewer, of an editor, of the publisher. So you're much in a better place when you want to publish your own work.
Yeah, and dare I say honestly, this? Sorry, Barbara, I was just going to say, don't know if I dare to say this, but I think it made me a more compassionate reviewer because I've been in the hot seat as the author of a paper and get feedback. And, I know how I feel when I get feedback. Immediate reaction is defensiveness. And then you look at it and you think, well, actually, they've got a point. And I think I've then started to think about the same thing. It's about how you like to get feedback or receive feedback. You try to give it in the same way. So I think my skills as at peer reviewing have also changed over the years, just generally understanding how to give it, in a more constructive way, I suppose.
I like that sort of compassionate peer review because of your own experiences. But the converse is also true, that I think that by being a peer reviewer, I became a less defensive reader of peer reviews of my own work. So I was, as I did more peer reviews, I was much more open to the fact that this peer review process is a conversation, and somebody has generously contributed to the conversation about my own work, and that takes time. So I think there's a lot. I feel as though we're being really positive about peer review here, and I think we should look at one sort of negative, and that is, we're so busy. Academics are so busy. And I think young academics are much busier than I was as a young academic. So I feel for people. And is there sufficient time to do this job? Is there sufficient recognition of this role to make it worthwhile for the junior academic?
I mean, you're right. Not only that, we've had a huge plethora of journals now being published regularly, and it's all too easy to get tables of contents sent to our email. But how much time do we have to actually look through that in great detail? I must say, I skim the topics. At least I know what the current, contemporary issues in medical education, I suppose. But I mean, time is definitely an issue. But I think with the students, I always try to frame it as a scholarly activity and something if they want to develop as educators and become evidence-based teachers or evidence-informed scholars, then they need to learn the skills, and it's about finding time to do that, I guess. But as with all professional development, we know what we have to do, and it's just finding the right time, I suppose. So I think in our courses, for example, that's something I'd like to get the students to take a little bit more responsibility, to organize journal clubs. So it becomes a little bit of a social activity also, where they come together, because we can do it online and they can join from wherever, but you get that benefit of other people's views on papers that you publish and so on. So I think in general, if it's facilitated and supported, then I think, in general, most of our students are quite interested in doing this, or at least start off being interested.
That's really encouraging. And
at the beginning, when you're a student or an early career educator, it's difficult to be selective of what you want to peer review because you're inexperienced. But as you gain that experience, it's very important to be selective and engage with the communities you want to be part of. So I usually favor peer reviewing for the journals that I read or the journals that I publish in. So that's also a recommendation, to engage with the topics that you are researching or that you are interested in, and also with the journals that you continuously engage with and you want to be a part of that community of practice.
Yeah, and that's part of deep scholarship, which is so satisfying. And talking about that, because we've talked about like community responsibility here now, and we've also talked about the fact that we are time limited. So Cesar, you've done a lot of research on what motivates clinical academics and clinical educators. Is there anything from your research that tells you about, what the advantages might be to peer review? Anything from self-determination theory that might be relevant to this discussion?
Yeah, I think there's quite an advantage when you look at the process of peer review from the lens of self-determination theory. I mean, in a nutshell, self-determination theory postulates that we all thrive when there are three basic psychological needs being met. So there is competence, feeling competent, relatedness, and feeling autonomous. So, and if we look at the process of peer review from the lens of those three basic psychological needs, we can identify things that will support the process. So in terms of competence, peer reviewing makes you a better academic. So it will encourage intellectual stimulation, continuous development. So you will develop more critical appraisal skills. So by engaging more and more in peer review, your competence as an academic will increase. Then the area of relatedness, as we were just talking, you will start engaging with a community of practice. So you will start engaging with that community, and you will also give back to that community of practice that you want to be a member of. So it's important in terms of making new contacts and meeting people. You will end up working with editors that you will, I mean, maybe some of those I've never met them, but I have a established relationship with them, a professional relationship. And then you get autonomy in terms that you're going to be able to choose what you peer review out of different reasons, because you're interested in that, because you want to contribute to a specific journal. So having those things in mind and seeking that why you are doing the peer review, I think it's really important in terms of doing it for the right reasons and not just to tick a box. I think we will all benefit much more if we find a good why instead of just doing it because it is what you're supposed to do.
Yeah. Can I make a quick point about Sorry, I was going to ask, can I make a quick point about educational theory underpinning what we're talking? It just came to my
Sure.
mind because Cesar talked about communities of practice. And we talk about this all the time with our students about all the underpinning educational theory. So there we talked about community of practice, but there's also this thing about a responsibility to learn, but us as maybe more experienced others to guide students who are less experienced and help them to become independent reviewers in the end. So I think the whole activity really lends itself quite well to educational theory and supporting learners to get to that point, I think, from where we start.
Yeah, that's lovely. And thinking about supporting learners and supporting our next generation of peer reviewers, can I ask each of you just to give one top tip to the new peer reviewer who's joining the work of a particular clinical education journal? So, Veena, do you have a top tip?
Yeah, I mean, once you get past the fear, I think of you know, and you sort of start to think about it a little bit more academically. I think the first top tip would be look at the journal, the guidance for reviewers, because too often we miss points that they make. Now, some journals have checklists that you can use, others don't, and you can use other critical appraisal frameworks maybe to do it. But I think generally journals and editors provide so much information for reviewers. I'd say always start by looking at the guidance for that specific journal first and then get started.
Fantastic tip. Thank you. And Cesar?
Following from Veena's advice, once you know what you're supposed to do and you have the guidance clear, and even if you have consulted with the editor some doubts that you have, once you are doing the process, remember that you are trying to help someone else to improve their work. You are not trying to impose what you would have done. And I find that sometimes that people, when they peer review, they just try to impose what they would have done. That's not our role, peer review, and we're trying to help them improve their work through their view of their understanding of what they're doing. So I think that's really important. And what Veena said at the beginning as well, how you're going to give that feedback. I know we all know how hard sometimes it is to receive feedback. So let's be mindful of how we're going to give that feedback and think of how you would like to receive feedback from one of your papers as well.
Lovely advice. One final thing that I would suggest is if you're doing it for the first time, don't be afraid of doing your first peer review with a mentor, with a co-reviewer. It will give you confidence, and it's a lovely piece of social learning that you're going to engage in, because you're going to chat about the paper, you're going to talk about research, you're going to just through that discourse you'll have a very nourishing experience. So I do recommend considering co-review and the role of mentors, which journals will sometimes provide help with. So yeah, listen,
Barbara,
this has been such
it's so rewarding when you follow the process of a peer review and you give feedback in several occasions, and then you see that paper published. It's quite rewarding as a peer reviewer to see that you have helped a group of authors improve their paper. You have been working with them, and then you see the product published. It's very rewarding.
Absolutely. Very, very good. Yeah, that is a very satisfying thing. And equally satisfying has been our chat. It's always lovely to see your faces and to do work with you. Thank you so much for all your insights and reflections. And we will have more chats about peer review again, no doubt.
Yeah, it was an absolute pleasure.
My pleasure. Thank you, Barbara. Thank you, Veena.
Thanks, Barbara. Thanks, Cesar.